Well, it depends on the person, that person's size, their height, their weight especially. But it's recommended if you go somewhere, if you're a man, have no less than 2 drinks. And if you're a woman, have only 1 drink to ensure that you're not being impaired if you're driving home. Now, when we talk about alcohol use disorder, it's very much more prevalent than we like to even think. The research shows that it's approximately 29 million Americans, which is about 10% of our population. So that means 1 out of every 10 people might have alcohol use disorder to some extent. Whenever we have suspicion as physicians, we ask a number of questions, but we use a very popular questionnaire called the CAGE questionnaire, which has an acronym. C is for, we ask them, do they want to cut down a little bit? The A is for, we ask them, is anyone annoyed, either them or someone in their family or on the workplace or a friend? The G is for, do you ever feel guilty? And then the E is for, do you ever need an eye opener? Maybe when you wake up, you need a beer or a drink. These are all red flags. And the way the questionnaire works, if they answer 2 or more yes, then we have a higher index of suspicion that that person might have a problem. And we'll either go into more questions or possibly refer them to an expert for a more detailed evaluation and possible treatment.
So give us some more details, Dr. Quinn, on how alcohol affects your organs.
Right. Now, we have 2 scenarios. We have short term and then we have long term. Short term is just basically impairment of your ability to think. So if you drink a lot more than you should, if you're driving, as I said earlier, there's a higher probability if you drink too much, you can have an accident to harm yourself or even someone else, maybe harming a whole family. There's also impairment in your decision-making process. Sometimes people will find themselves in a compromising position. Maybe they've gone too far with a significant other that they weren't ready for that step yet, or maybe someone they just met. We did just do a segment on STDs, where people might drink too much and then they might have relations and they had a clouding of their judgment. So we have to really watch that drinking. The long-term effects most commonly are effect of the liver, where you can go into cirrhosis and that could take your life. And then the brain, where you have a higher chance of dementia. And then the heart, where you can have increased blood pressure, higher probability of a stroke or a heart attack. So this is something that we really need to take seriously.
Okay, real quickly, we're running out of time. What are the resources that people can take or go to if they do have a drinking problem?
Right. So they can go on the internet, just go on Google, Alcoholic Anonymous. They have a lot of different programs you can get into. And if they don't have the best insurance, there's a lot of money out there that will help to subsidize so people can get the help they need, not only for themselves, but for the community at large.
All right. If you do happen to drink, be sure to have a designated driver. All right. Thank you so much, Dr. Quinn, for your time as always.